Imagine yourself being so sick and in pain, not knowing why or what is wrong. You become depressed, unable to sleep. Because of this unknown illness, you are unable to work. Therefore, you are no longer able to support your family. All of this because you're unable to speak English. My name is Becky, and I'm here to inform you about the importance of limited English proficiency. It is essential at this time to take action against limited English proficiency, also known as LEP. Today in the United States, there are many problems in our healthcare system, and there are many barriers in languages for the people with limited English proficiency, whatever the language may be. Bilingual in hospitals, clinicians, medical staff should be assessed to make sure that they are interpreting medical translation in a correct way. Because, let's face it, our health is our future. And therefore, if you have limited English, then you're not able to know what your symptoms, you're not able to know exactly what your problems are and how to prevent those problems. In addition, I think that hospital and physicians' offices should develop and review policies on interpreters, services, or in using bilingual staff. For example, a patient calls in to a doctor's office for themselves or for their children, and the clerk does not speak their language, nor do they have an interpreter on staff. The patient has no choice but to hang up and are without the medical attention that they were seeking. The same patient goes to the emergency room because their symptoms have worsened. Once they get into the emergency room, again, there is no one to interpret. So this patient is being treated without the physician knowing the full details of their symptoms. This could be very lethal to a patient's health. The New England Medical Journal stated that in 2009, only 25% of hospitals had full-time interpreters on staff. There has not been any improvements, nor has there been many steps taken towards limited English proficiency people to have access to these limited healthcare services that they are needed. I feel that healthcare needs to put in place some policies and procedures for these limited English proficiencies because this will make our healthcare and our health system benefit us in many ways. By enforcing policies and programs, we will be able to have much better understanding on what procedures and what it is that patients need to do to prevent future health care. One, patients will be able to get the proper health care that they require, understand the conditions, and learn how to be proactive against those conditions. With these policies, I feel that we will begin to see more patients that are insured because they will have the knowledge and know the steps into what needs to be done to get medical health care. And also, this will help them to obtain a primary care physician to treat them for their ongoing problems. In addition, I feel that hospital and physician offices should develop new policies on interpreter services and using bilingual staff. By the following, I feel that they should prepare and maintain a list of proper interpreters, identify and record the patient's primary language in their chart, review and standardize certain forms that need to be translated, consider using picture and phrases for the patient, and also establishing a community liaison group. This will help patients with LEP to become more engaged in their health care. With that being said, once physicians and patients are able to communicate with each other, they are able to better improve, educate, and become proactive to their future health. I would want to like to leave you with the words of Christian Dawson. The greatest obstacle to international understanding is a language barrier. Again, my name is Becky, and I hope that I informed you enough to take the steps in making our healthcare better one day at a time.